I will give a quick introduction to myself since we have a couple of new members joining us today. I'm Andrew Van Winkle. I'm the chairman this year of the Behavioral Health Advisory Board, and happy to have you here. And when we get to the new members, we'll have you introduce yourselves real briefly after we do the roll call. So we've got Kim Taylor here, I see. Do we have Craig Davenport there? Yep, there's Craig. And we've got David Lund, one of our new members I see just joined us. Gail Kogel is here. Jackie Sauer, another one of our new members I see has joined us. Jamie Rostek. We have Jamie here yet? Okay, not yet. Jill Burkholder? Not yet present. Chris Thompson?
Here.
All right, thank you. We've got Lita Phillips is excused today. Lori Moon? No Lori. And then Michael Lindsley, I see you're here.
Present.
Then how about Kat Nichols? See, we've got Ashley here and Jessica Thompson. Do we have Justin here yet? Not quite yet. All right, and then we've got Katarina Rice and Crystal Kenyon. Nancy Locke is here, and Tom Gose is here. All right. So before we move on here to approving the minutes, just want to give our new members a moment here to introduce themselves to the rest of the board. So David, we'll start with you.
All right, my name is David Lund. I live in Spokane, and I work for the Secretary of State's office. I have a pretty extensive history in reentry and just completed my first quarter at EWU in behavioral health.
Well, congratulations and welcome. I think you'll find this will be a good group. Jackie, how about yourself? Well, it looks like we lost Jackie. She was here and then she's gone. So we'll come back to her if she comes back. Moving forward with the agenda, do we have anyone here who is ready? Excuse me. See that Jamie Rostek is here now. Jamie is one of our new members joining. And Jamie, I'll give you just a second here if you want to introduce yourself to the board.
Okay, sorry, I had to turn on my video. Can you hear me?
Yes.
Okay, my name is Jamie Rostek. I was really interested in joining the board because I work in the community with a lot of people, but I also have lots of experience of navigating the system on my own with my family and some of the struggles that we've been in. So really interested in being a part of any kind of help that I can. I currently work at CHAS. I'm the clinical supervisor here. And today I'm actually at the Denny Clinic seeing patients. So.
Well, welcome, Jamie. Thank you so much for joining the board. All right. Has everyone had a chance to review the minutes from the March meeting? Anyone have any changes or suggestions for the meeting minutes? All right. How about a motion to approve?
Motion to approve.
This is Kim. I will second.
Thank you, Kim.
Way to go, Kim.
All in favor? Aye.
Aye.
Aye. All right. Any opposed or abstention to adopting the March meeting minutes that went out? All right. Those will be adopted. And I jumped ahead a little bit and introduced two of our new members here, David Lund and Jamie Rostek. And then do we have our third new member here yet? Nope, still having connection problems. All right. So with that, Gail, we'll just move right along to you.
Good afternoon, everyone, and welcome to new board members. My name is Gail Kogel. I am with the Office of Behavioral Health Advocacy. Previously, we were called Behavioral Health Ombuds, and many of you may have known about ombuds being available to those who are enrolled in services or could be or would have or have been in behavioral health services and who need the assistance in getting some things figured out. There's been some recent reorganization information I wanted to present. So previously I was a program director East. We have expanded a bit, and I have taken a step back to just behavioral health advocate. The Spokane region is very important to me, and I also have some need to travel periodically because I am DPOA from my mother with dementia. So it just made more sense for me to just stick my focus into the 6-county Spokane region, which is where my heart is actually. So it doesn't change anything about how I contribute or what I do. So I don't have anything written or a PowerPoint to present, but I just wanted to touch on a couple of things that I've been doing. And so every month I host a behavioral health forum, and I try to keep topics that are fresh and that are pertinent to what's going on in this region. It's the second Wednesday of every month from 3 to 4:30. Please let me know if you would like an invitation to those forums. We have a wide variety of things we talk about. And that has, that's just been the case ever since we started it. And you know, some recent trends that I've seen, and that is that no matter what topic we have, I've listened to a lot of family with kids who are autistic or autistic adults who now are working, but are professionals. And I'm hearing a lot about now the crisis system and how services aren't necessarily meeting their needs. And so that's just something I've been exploring a little bit more. And that also comes into context when earlier in January and February, I was hosting forums and trying to get a better look at what are the needs of families who are waiting to get their kiddos home from CLIP, Children's Long-Term Inpatient Program, for those who don't know what CLIP means. And specifically from Child Study and Treatment Center, CSTC, and listened to a lot of families, and these weren't always in our region, who were feeling like they were left out of the discharge process, and that they didn't have a good feel for the support that they needed to have wraparound services. So these are some of the things that we have been discussing. To me, it just seems like the theme that keeps popping up, and I don't know if it's because of the audience that has been coming, is that people who are autistic are not getting all their needs met, and that they are looked at as their autism first, and anything else that's going on with them second. So I hope to be exploring this a little bit more in the future, but if you have any questions, feel free to reach out to me. I have been attending a lot of events. On Saturday, it was the Peers Empowering Peers event at the Central Library. Prior to that, it was there was something in Spokane Valley that was a Connect resource fair. These are places where traditionally I have not gone to let people know, and these are aimed at people who are homeless and very low income, that I have not gone to present information about their rights and what is available to them should they need the resources of an ombuds. Or also an advocate. The word advocate can be really misleading. And so I've been examining some of our own information that we publish, and it can be misleading. So we aren't there to accompany somebody to court, you know, if they have a ticket that they need. I mean, I get questions about that a lot. There's things that are outside the scope of what I can do, which is more short term. And so I'm now starting to tell people, okay, remember the ombuds, or if you don't know what that is, I wanted to let you know that I am a behavioral health ombuds. And I think it's been kind of a process still with some of the changes that have happened. And this goes back to 2019, when our whole state system changed dramatically. And we went to a statewide managed care system with managed care organizations that administered the behavioral health services in our respective regions, other than the behavioral health organization or the BHO that was in place at the time. I think on the plus side of that is that since we've had the transformation project, or whatever it's called these days, the integrated managed care transformation, that there are more providers that are now providing these services than we have traditionally seen. And this is some of the outreach that I'm trying to attain, is to reach those newer providers and let them know who I am and where we can be a partner and also assist with people. I'm finding a lot of providers don't know anything about who we are and what our role is and how we really can help them to resolve people's issues that they have and provide a really robust system of care. So that's been a challenge. Another challenge we've had is that I'm finally going to be moving into an office. We have leased some space down here on West Sprague. There's no office furniture yet. I happen to be in it. The tenants who vacated were attorneys, and they left behind some nice furniture. So right now I'm sitting in a board chair, which, you know, the ones that go around a boardroom, that's really kind of stuffy and stuff, but it's not the best one to do your work in all day long. I have to tell you that. For anybody who has lower back issues, it's not what you want to use to be doing this. But I'm really looking forward to being able to have a central location where people can actually come. It will be nicer than, I mean, I'm always willing to meet people, say at the library, or I've even met people at McDonald's. I've used all kinds of different places to meet with people that we can have privacy, but to have an actual space that's on the bus line where people can come is great. So that's great. And we're also going to be hiring something called an advocacy coordinator. This is a person that will be fielding the calls, that will be initiating the intakes for us. It really does help. We have a couple of advocate coordinators on the other side of the state, and it's been great. So it would kind of takes the burden off me of having to do it all, to take the intake, to do the input into our database. That I'm going to tell you that I'm not that fond of it. It's very kind of cumbersome to work in, but you know, we have to have the documentation in place. I'm trying to think of some other things. I just made some notes, just really kind of quickly. So in May, my forum was on the Peer Navigator program. And prior to that, I was looking at, you know, what kind of services are there available for people who are trying to avoid incarceration or who are newly coming out of incarceration. And I think that this is a subject I'd like to explore further. We had Pioneer present in May, and I know that each county has its own, and I was negligent in not inviting them. So I think this is something that we can do too. And just to let everybody know that the forums are very grassroots. It's very organic to what our region is asking for. I try to guide with the topic or what I think is happening that I'm seeing, or what kind of issues that people are bringing forward in this region. But but it's open to everyone and anyone. Just somebody who's interested in what's going on in our region, but also someone who is very involved in our services. And have providers that come, people enrolled who come. So that's kind of been it. Another thing that I'm really happy about is that if you don't know, Substitute Senate Bill 5660, which was passed, which to mainstream the mental health advanced directives. And I'm hopeful that beginning in July, we will be assembling a couple of really key work groups to be able to not only figure out how to make it more mainstream, how to make it usable, make a tool usable, but also to help educate providers, the inpatient providers, of what these are and how they can be a benefit and how to honor them. I've had a couple of calls from people who were named as the agent on somebody's mental health advanced directive, but who were being denied any kind of information because they didn't have a specific release of information for that time period. These documents are or can be notarized, and they should be. So once they're notarized, that's the document. So that's what we're hoping to do. So I'm really excited to do that. I will talk to anybody about creating a mental health advanced directive and talk to groups or just an individual and let them know about what it means and what it does. So what I'd like to ask though is that, since trying to do more outreach, so that if you have, so that BHASO, if there's some provider meetings that I could maybe come and present to, that would be great. I do go to Better Health Together. I am a member of the FISPERT. I'm a tri-lead on the FISPERT team. I also am at the state FISPERT. I serve on the long-term care advisory committee, and I educate folks in about what's going on in our behavioral health system of care as much as I can. And so just if that could be something that I could do, or if you'd like me to come and talk to your group, I'd love to do that. The more people that know about what we are, what an advocate we can be, an ombuds, and how we can really help keep our system healthy and that people are listened to. I just want to briefly touch back on the long-term care advisory committee. They've asked me to be on an ad hoc committee because they are seeing a number of people who are being discharged, semi-discharged from a assisted living or a skilled nursing facility, going to inpatient because something's going on with them and then not accepting them back, which leaves them in limbo. There are a couple of assisted living or group homes in our region that I directly would have involvement with. Sunshine Terrace is one, but places like Bethany are under the long-term care umbrella. So they have that specific directive that they would work with those individuals who have a complaint or is concerned. So this is just something to know about. I hope to be able to report more about this at future board meetings, and please let me know if you have any questions.
Thank you,
Gail,
Gail.
thank you.
for the
This is
update.
Kim.
Kim,
Yeah, Gail, are you thinking since you were going to have a physical space that you would do some of the monthly meetings potentially in person and or virtual?
You mean at the forums?
The forums, yes.
No, they're only going to be on Zoom at this
Okay.
time. There's no change. There's no plan to bring them in-house. That would require specific equipment
Got it.
and a setup so that people could be here and be participating. So hopefully if people do have access to Zoom, it's the most commonly used platform. I know a lot of especially government agencies have gone to Teams. That doesn't work for everybody. So we're going to keep it at Zoom for a while. And I don't mind if you come in a little bit later, leave early, as long as you have a chance to provide your input.
Got it. Thank you.
anyone have questions for Gail about her updates?
No, I just want to say, Gail, we're extremely grateful for you and the amazing research that you've been over the year, and for all of our new advisory board members. If you want any information, plug into Gail. She is a wealth of knowledge, and we're so lucky to have her. So thank you, Gail.
Thank you.
I just want to echo that. Gail, I appreciate your advocacy on mental health advance directives. My dad has the early stages of dementia, and my siblings and I, we got him a mental health advance directive filled out and notarized last year. And it was a lot of work, and he's not quite at the point where it's kicked in yet and he needs it, but we're happy to know that it's there for when his dementia reaches that level. So I appreciate your advocacy. That's an important tool for families to know about.
That's somewhat different for someone with dementia. As I, said, I'm the durable power of attorney for my mother in Michigan, which is one of the reasons I stepped back from being a director. It is a very, it's a grave responsibility that you have to make sure that someone's welfare is being honored and looked after to the best of where they are and who can take care of them. So yeah, I'm glad that you're doing that. That's awesome.
So moving on with the agenda, we've got our third new member here now. Jackie was having some trouble joining us, but she's here now. So Jackie, are you able to give us just a little introduction to yourself?
I seem to be muted. There we go. Hi, my name is Jackie. Can you hear me okay?
Yes.
And let's see, a little bit about myself. I work over in the School of Medicine and with the Health Partners, with Gonzaga Health Partners. And I am learning about the causes that are being very valiantly fought here. So I'm a student in this, learning about this. Thank you.
Well, thank you for joining us, Jackie. I hope you'll find your time on this board here fulfilling.
Thank you.
All right, so we are moving on to talk about the block grants, and we will go to Ashley for that.
Thank you, Andrew. I appreciate that. Crystal, would you mind pulling up the SABG block grant plan, please? As she's pulling that up, we will be reviewing the federal block grant plans, federal funding block grant plans that we receive funding for, and these plans get submitted to the Healthcare Authority. Before that submission to the Healthcare Authority, they are presented here to the BHAB and then move on to the Board of County Commissioners for final approval and then get sent to the state annually. And Crystal, are you having any? Go ahead.
It shows on my end that it is share screen. Are you not able to see it on my end?
I'm not. Is anyone else seeing it?
Oh,
I still
gosh.
see the agenda.
No, I'm not seeing it either.
Well, something just happened. The agenda went away. So that's hopefully a good sign.
There we go.
That's usually a good sign. You have to stop and then start. It's funny.
There we go. So this is the substance abuse block grant plan. And this is the proposed plan narrative section that gets updated annually. There was not many significant updates to this part of the plan. There was some added languages in the cultural competence section. The needs assessment, I believe we updated in 2022 to allow for AIAN populations under fee-for-service specific to sobering services. And this is something that, though gets updated, we still are experiencing a lot of the same challenges as a region. One of those major challenges, thank you, Gail, is workforce shortage. I think that's something that's definitely been felt across all different types of disciplinaries and professions. And we continue to see that as an impact to the behavioral health system of care. You can scroll down, Crystal. And thank you for making these sections large. I apologize. I know that this spreadsheet isn't the most user-friendly to review. This is the spreadsheet that's provided to us by the Healthcare Authority, and this is exactly what we submit back to them. And so apologies for any challenges with trying to get those sections open and expanded. And so like I identified, there was just the call out for languages added to the cultural competence section. And this is where the AIAN, American Indian Alaska Native fee-for-service, was added. And this was to allow for sobering services to call that specific population out to ensure that sobering services could be covered under the block grant reporting for that. You can continue to scroll down. For staff education, continuing education for staff, apologies. We did add thank you. We did add the Indian healthcare provider training for CEUs for staff within the last year or so in there. You can scroll down on that. Charitable choice, there was no updates to this section this year. Coordination of services, we did add, and I believe we've had them come and present to BHAB before in the past, the NAMI Navigator for care coordination. And no updates to public comments, local board, behavioral health advisory involvement, program compliance, recovery support, or the cost sharing optional section here. These were sent out with a meeting agenda. Are there any questions regarding the narrative section of the plan? Oh, Crystal, can you keep sharing that? Apologies. We have one more tab to review on there. All right, and if you can click over to the project summary and expenditures tab at the bottom, please. In this section, it calls out the specific amount of funding that we are allocated and how it is divided into each of the categories. The caveat, I will say that the allocated amount of the funding that is provided and is reflected in here does not mean that all of that funding is contracted out. With block grant dollars, there are specific limitations as well as requirements associated with that funding that can create some challenges to be able to present in a widespread manner, along with who that funding can be allocated for. However, we do utilize that, and it is a great impact to our community. And so as we scroll through here, you will see a few changes that did occur. Specifically, there's no changes to this section. But specifically, when we scroll down to outpatient services, there was a small reduction in this section. I will say there's some shifting of funding. So there was 3 small reductions and then 1 major increase to one of the sections. But with those changes that did occur in the shifting of the funding of this report, no drastic or major changes to provider coverage or funding allocations were made. So all services that have been paid for within the last year have been fully covered in this year's plan as well. There's no disruption to the providers that's providing care under any of the contracts that receive this funding. So there was a reduction in the outpatient services section, the acute intensive services section, and recovery support sections, all sections where there was funding available to be shifted, and that funding was shifted to the intensive support services section for the purpose of expanding funding to expand and support sobering services for our community. And so, as you know, that's a service that is very needed and something that we continue to try to enhance and operationalize and expand in our community. And we wanted to be able to have and ensure that there's funding adequately there to support changes as they come along with that service. Are there any questions about this section of the plan? All right, Crystal, if you could pull up the mental, or I'm sorry, we can go over to the co-responder tab on the bottom as well. One quick update about that. So both the mental health block grant plan as well as the substance abuse block grant plan had funding allocated towards a co-responder. This was funding, it was a small amount of funding. And as mentioned before, it came along with a lot of different requirements for that funding. It was something that was never allocated out or contracted out because of the challenges that exist with that. So this year, the state actually reduced our allocation by the co-responder funding amounts and is going to be reallocating that to our region that can utilize those funding. But stay tuned for our SCR-BH updates because I have some more updates regarding co-responders in general in our region and plans for that. And so just because this funding will not be allocated toward that doesn't mean that we don't still see a benefit to that service in our community. All right, now the mental health block grant report. While she's pulling that up, I'll also indicate that we also receive ARPA funding, block grant funding that is on top of these 2 reports are our base block grant reports, and the ARPA funding is time limited funding that was provided to also provide expansion of services. So we have not made any changes or allocations to that funding in the last year. That is funding that though is available, is not something that is sustainable because it is a short-term funding will actually be ending in September of 2025. And with that, we didn't want to put out funding that would not be able to be supported unless we had a sustainable way. So though that funding is there, it's going to be going away here shortly. And with plans like our substance abuse block grant funding, where money is not fully allocated out and not drawn down from the state because of usage, then we didn't want to add additional funding that would not be supported long term. So here is the mental health block grant plan. And in terms of this plan, there was no changes in funding for this next state fiscal year. We did do a few updates in the different sections, just adding programmatic areas where we have evolved since then. So our Youth Behavioral Health Navigator program, the Teen Text Line, and some just updates, formatting updates. But nothing substantive was updated on this report. Block grant dollars, mental health block grant dollars continue to be contracted out and expend at a higher rate than our substance abuse block grant dollars. And so there were no changes to be made, and services will continue as identified in the plan and the summary and expenditures. The only change on this plan this year is the co-responder funding, similar to the mental health block grant. Are there any questions on the mental health block grant plan?
Ashley, was there money in the block grant that was previously allocated to Daybreak that's now going somewhere else now that Daybreak isn't up anymore?
That is a great question. If there was funding, let me look here quickly, and just because, off the top of your head, it likely would have been our substance abuse block grant funding, which again is something that though it's contracted, it's not all expended. And so we haven't reallocated any funding that was from Daybreak to any other areas.
Okay.
And I don't know that off the top of my head either, but I can definitely look into that more, and we can get back with you if we don't have time today to fully answer that question.
I appreciate it. Just something I'm curious about, since that's kind of a provider hole that showed up this year, and there's not really anything taking the place.
Yeah, and I think the challenge, and you make a great point, Andrew, I think the challenge that we continue to see is access to substance use treatment for youth and minors that are in need in our region. And I don't know that we've necessarily had new providers present in our area to take up that service. Though I know the state has been committed to exploring what that can look like. And I know they have done reach outs to behavioral health providers that are providing mental health treatment to see if there's any desire or support that they could offer to duly license those facilities as substance use facilities as well, to try and increase the accessibility to those services, not only in our region, but in the state.
It's a huge need.
Absolutely. And I don't believe, just taking a cursory look on that, Andrew, that any of the funding was block grant dollars.
Oh, thank you.
Yeah, of course. All right. So next on the agenda are the updates from the ASO. Just let me scroll up here. And so currently right now, we are in the midst of our annual monitoring by the Healthcare Authority for all of the contracts that we oversee and are passed through us. And so we are on track. If we've been a little inundated lately, it's because of that, or a little less responsive. So apologies on that, but we are on track to submit that tomorrow to the state. And so feeling good and confident about that. Another thing that I had talked about previously on the block grant reports was co-response. Something that we are looking at exploring in our community is the expansion and initiation of co-response services partnered with FIRE. So behavioral health clinician partnered with a firefighter EMT to be able to provide a co-response dispatched out through 911 system to individuals experiencing non-acute medical and behavioral health emergencies, and ones where safety is not a concern. If you are familiar at all with the circumstances in Spokane County, we have co-responders through the Sheriff's Department. Through that contract, there's also co-responders that respond with SPD as well, so Sheriff and SPD. And we also have one unit with Spokane City Fire has one behavioral health co-response unit with the fire department. And we are looking to expand that to provide a more comprehensive and fully accountable system of continuum of care for individuals in every avenue that they might come into interaction and need a behavioral health response. So the hope with that is to be able to, similar to co-response with law enforcement, divert from individuals who are having a behavioral health crisis from the criminal legal system, as well as divert individuals having a behavioral health crisis from the ER hospital system, and instead try to provide those services in the community, in the home, and connect them with the appropriate resources, or in attempts to get them to direct facility intake versus having to go through another system of care to get there. Jessica, is there anything you want to add to what I said on that?
I think you covered it really well, Ashley. We're really excited to plan this new project and find another way to better serve our community through this. So more to come.
Definitely more to come. Any questions or comments on that project? All right. So the next update, I believe back in January, Jessica provided an update regarding opioid settlement funds survey. So the county is receiving opioid settlement funds along with other municipalities within our state and within our region related to opioid settlements, specific to the opioid epidemic that we are experiencing. Spokane County has elicited our assistance in developing priorities for that funding. And so there was a survey that was put out in the fall for Spokane County residents, and we received a great turnout of results on that. I think like 204 individuals, community individuals responded to that survey, and that information was then brought to an expert review panel who then also provided feedback and input based on the survey results. That information was brought here to the Behavioral Health Advisory Board for presentation, feedback, and input, and then it was presented to the Board of County Commissioners. Through that process and through a couple different mechanisms of legislative change that occurred throughout this process as well, priorities have been identified, and the board has put out a resolution regarding some allocation of funding for those specific opioid settlement funds. One of the big projects that is being worked on right now is looking at expansion of the Spokane Regional Crisis Stabilization Unit to include a 23-hour crisis relief center and sobering center. And so that's a new designation that came out within the last couple of years that allows the crisis relief center part is sobering's been around for a while, but allows for individuals to walk in or be dropped off by first responders, law enforcement, or a transfer from the hospital to that facility, and to be able to be in a safe, secure, trauma-informed environment for 23 hours and 59 minutes to receive services, to receive connection to services. Our hope with having it co-located at the Spokane Regional Crisis Stabilization Center is that individuals can move from that level of care to a more appropriate level of care as they are able to receive their needs met in a crisis situation. The Spokane Regional Stabilization Center, if some of you are aware, some of you might not be aware, offers 3 different levels of care. They have mental health stabilization, co-occurring treatment, and withdrawal management treatment there. And those are all services that require medical necessity. The difference of this facility is that there's no medical necessity requirement to receive services there, meaning that it's an easy place for people to walk in and receive help. It's something that if law enforcement, first responders are out in the field and they're engaging with an individual, they don't have to make a determination about what level of care, what assistance they might need. They can take them to this location to receive that service. And so that will take a couple years to explore and to build out. And so we're in the initial phases of that, but very excited about what that can mean for our community. And with that, we're also looking at a direct influx of funding to the community for the here and now to be able to expand and provide for sobering and triage services to allow for individuals to get that care here and now. For the sobering is 23 hours and 59 minutes. Triage allows for an individual a safe place to be while maybe they're transferring to a different level of care, and that transfer might not be immediate, so allowing that kind of interim service to be provided. And you might have seen recently there is a current request for proposal that is out regarding that funding currently, and so there will be more to come on that, but we're excited about that as well. One of the third projects identified as well is funding for housing support for caregivers and infants with infants with neonatal abstinence syndrome or medication use disorder, or I'm sorry, substance use disorder, needing treatment. So what we recognize is that a lot of individuals that have infants with neonatal abstinence syndrome are in recovery, can be in a supportive setting initially, but then once it's time for them to kind of be out of that supportive setting, the housing availability of housing resources that provide safe, secure for their recovery is not necessarily always available. So funding to provide a capital investment for that to be explored and expanded upon. And there's a current request for proposal out for that currently right now as well. Jessica, did you want to speak on any of those?
No, I think you covered it. I think most people in this group saw the emails go out regarding those requests for proposals. Those went out on May 24th and will be open, I believe, through June 12th. I may be wrong on the dates, but those are out there. And through that process, we will seek a contractor for those services. And that's done through an anonymous process. So we have a review committee of the RFPs made up of subject matter experts in the respective fields related to the RFPs. And then the proposals are redacted, so no identifying information regarding the agency or organization that has applied is there, so we can remove biases from those. So we will be undergoing those processes here shortly, and are excited to select a contractor and start serving the community through the utilization of opioid settlement funds.
There was one other area that our department isn't involved in that the Board of County Commissioners identified in the resolution. That's funding for the Sheriff's Department to explore drug analytics when it comes to the criminal legal system and substance use disorder and opioid. Any questions or feedback on that?
And I would just add, Ashley, to the analyst that you were just talking about. I believe the goal for this was to be more of a preventative option, so that we can reduce the amount of drugs and opioids that are seen on the streets, as well as have a better way to really see what the problem is that we're facing, because we don't have good data. So the more we know, the better we can respond. So just a little bit more information on that. Again, that's not within our department, that's through Spokane County Sheriff's Office, but that is the information that we have thus far.
If you want me to add a little bit
Yes,
to that, I
thank you.
can.
Yes, please.
So obviously, with the increase of fentanyl nationwide, worldwide, we, as like any other state in the United States, is experienced that influx as well. And unfortunately, with that, the lethality that goes with it. So we petitioned, obviously, for additional funding to hire an analyst that would work with our mid to high level narcotics and violent crime unit for the preemptive effect of tracking trade routes, dealers, handlers, so that we can potentially get ahead of the game, figure where they're out, and make the seizures we need to identify the top targets and strategically go after them.
Thank you for that, Chris. And very much an upstream approach to stop it from the very beginning of coming into our region. So there, I'm sure will be a lot more to come and updates throughout this process related to opioid settlement funding and the different programs and processes involved with all of that. And we appreciate all the feedback that everyone's been able to provide on that. It's been very helpful in this process as we navigate the different areas of need in our region. And that's it for ASO updates. Though I will say, and Gail, thank you for your update earlier. I know in the last couple board meetings, I've provided some updates on our Youth Behavioral Health Navigator program, also known as REACH, which is for Resource Engagement for Adolescents and Children. That's our regional title. And Gail, I believe you've been involved in the steering committee and that process, but I know that's something that they've been experiencing and receiving a lot of referrals from the community for is individuals and youth that have autism diagnosis or have an intellectual or developmental disability, and the need for resources specific to that population is definitely being identified through the work that they're doing as well. So they can definitely echo that. And I know are working hard to compile and explore what resources are available and make sure that they can try to make those connections as needed as well.
All right. Ashley, Jessica, were we wanting to have the board take a vote on the block grant proposals, or is that just informational this month?
Yes, a vote, please. All of these on that. This is my first go around.
Wanted to make sure we didn't miss that before we moved on here. So is there any more discussion or questions about the two block grant proposals before we move on?
I think good summary, Ashley. Thank you. And I would move to accept the proposals as presented.
Thank you, Kim.
Second.
Thank you, Michael. All right. Doesn't appear that we've got any further discussion going on, so we'll move to the vote. All in favor of the proposals, say aye.
Aye.
Any opposed or abstaining? All right, it appears that the vote is unanimously in support of the proposals as presented, so we'll have that reflected in the minutes. All right, moving on to the Consumer Consultation Panel report. Tom.
Yes, I have here my minutes from March and April. First, I'll do March. At this meeting, our guests were Kaylin Roy, a liaison to the BHASO and CCP, and Gail Cole of the Office of Behavioral Health Advocacy. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Goss, Aaron Smith, Robin Segner, Sarah Leake, and Sophia Alexander. The online March CCP meeting was called to order. The February CCP meeting minutes were read and approved. There was no February Behavioral Health Advisory Board meeting, so this was not reported on. There was a CC budget request update. The budget has been increased from $300 to $500. It suggests that we use some of this money to buy a microphone. It was also suggested we keep the recommended donation for a Santa picture to the CCB Santa event at $5. Kalen then said that he will update the CCB charter and bylaws in July, and we use BH terminology. Discussed the Jaunt in June, a walk-in event put on by the CCP. We suggested that we mention to Jaunt attendees that the event includes the idea of reducing the stigma of mental illness. Sophia said that Evergreen Club will attend the Jaunt. Brent said that Evergreen should try to provide snacks, sack lunch for members who attend. Brent also said that he will try to contact FBH about the event. Sarah said that she will try to contact Catholic Charities. Robin or Brent said they will try to contact Carlos Valley. Brent said that he invited Unified Health but hasn't heard back. Gail said that she will invite Pierce Spokane. Erin said that she will try to contact a group having to do with service dogs. Robin says that she will try to contact EWU. It was suggested that the CCP reach out to Community Health Plan of Washington, Labor Ready, and the responders at the Medical Lake Fire. We intend to buy a banner for the event. Brent noted that the banner will be cheaper if it is 8 feet by 2 feet rather than 10 feet by 2 feet. It was suggested the banner be blue with yellow letters reading Consumer Consultation Panel. It was mentioned that the cost of cords to connect the banner to a post will not be expensive. It was also mentioned that we should wait until next year to buy new t-shirts for the panel. Robin said that she will put a new giant flyer on the CCB Facebook page. It was noted the CCB is opening for 4 people 18 and over and 2 openings for people 18 to 24. The next CCP meeting will be held online on Monday, April 8th, 2024 from noon to 1 p.m. Meeting was adjourned. And here are my minutes from April. At this meeting, our guests were Kaylin Roy, liaison to the BHASO and CCP, Gail Kogel of the Office of Behavioral Health Advocacy, and Alvin Pittman, a possible new CCP member. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Goh, Sarah Smith, Robin Segner, Sarah Lee, and Sophia Alexander. The online April CCP meeting was called to order. The March CCP meeting minutes were read and approved. Alvin Pittman was introduced and voted in as a member. We discussed the March Behavioral Health Advisory Board meeting. At this meeting, it was noted that Behavioral Health Advisory Board members Michael Limberger and Jill Burkholder terms have expired and will not be renewed. There was a SCRBH disaster response report by Kaylin Roy, who works for Spokane County Community Services Department. All the responders in the BH field try to complete a course to prepare for disaster. This came about with the Freeman shooting. There are 40 volunteers responders. They hold meetings and work with Spokane County Emergency Management. They hold disaster response exercises and work with FEMA. One recent experience was the fire at Medical Lake. Some responders were called to assist at SFCC where victims were housed. Federal funding has been approved for Medical Lake and Elk fires. There was an administrative update by Jessica Thompson. She gave the data dashboard update. At this time, there were 271 high utilizers, 11,993 regional crisis hotline calls, 4,942 individuals served, and 18,513 total services provided. This is all on the data dashboard website. There was a legislative update by Ashley McGee. The legislative session had just closed. She said that there is a House bill that extends current worker protection, which passed. Also, a House bill passed incorporating better care for tribes, providing for their medical treatment. There was a Senate bill passed which provides suicide prevention services. It was noted that FBH does a regular crisis line as well as 988. There was a Youth Navigator Program REACH, or Resource Engagement for Adolescent Children, update by Ashley McGee. This program has a steering committee. One recent action item was access to care. It was reported they hired their first care manager. They have team meetings and a multi-system of care. Ashley McGee also reported that BHAB members will be provided with funding to attend the BH conference. The CCP was then informed that it was increased to $500. Also, the CCP was informed its charter and bylaws allow new BH terminology. We discussed the Jaunt in June, a walk-in event put on by the CCP. It was noted there's only one more meeting before they join, and the CCP needs to schedule an extra meeting in May. It was also noted that the CCP has been given the okay to hold the event at the main FBH center. Sarah said that she would try to contact Revive, an agency who would help people with housing and employment, about attending, and will also try to contact Catholic Charities. Erin said that she will ask Prim to attend. Brent suggests that we ask Robin Nance of KXOY to speak at the event. Her daughter has lived experience. We suggest that we also invite AmeriGroup, WellPoint, NEMI, and Passages to the event. Sam Alvin said that he will contact the VA about attending. It was mentioned that Evergreen Club will attend. Brent said that he has signed from last year, but they need to be attached to sticks, and that Carlos Salvalle has signed for previous years. It was mentioned that we may need markers and tape in case the signs need a makeover. Brent suggested that we arrange the tables for vendors in separate rows. It was noted that we have a banner and pop-up, we need cords to hold it up. It was also noted that we need snacks and raffle prizes for the event, and that we need to advertise for the event by putting giant flyers on cars. It was suggested we ask Kelly Miller and Carlos Savannah post about the event at FBH offices. The next CCP meeting will be held online on Monday, May 13, 2024 from noon to 1 p.m. Meeting was adjourned. Those are my notes.
Thank
Thank
you.
you, Ron.
I see that Gail just posted in the chat the information about the Jaunton June, which is tomorrow. So if anyone is interested, please respond to Gail on that. All right, board comments. The only thing I'd like to say is over the weekend, NAMI had its 4th annual fundraiser walk, and I was able to attend it, and I was pleasantly surprised at how well attended it was. The first walk that they did 4 years ago had 6 people, and this year it was well over 100 people. So they are getting the word out. It's just
Good.
nice to see so many people there supporting the mental health community. All right, any other comments from board members? All right, public comments. All right, how about a motion to adjourn?
Motion.
I'll second. This is Kim.
Thank you.
Thank you,
All right.
everyone.
We'll be adjourned and the next meeting will be July 22nd.
Sounds good. Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Thank you all.
Mm.